Reports about quack medical practitioners finding their way into the country's public and private health systems come up from time to time, with some of these practitioners being found out by the law. The operations of such unlicensed health professionals continue to pose danger to unsuspecting clients who patronize their services. The Allied Health Professions Council, mandated by an Act of Parliament to ensure high standards in the practice of allied health profession in Ghana, describes as worrying the activities of unlicensed health professionals in the country's health system. Officials of the council visited 16 private medical laboratories situated close to the Komfo-Anokye Teaching Hospital, out of which only one was in good standing. The other 15 facilities had engaged the services of unlicensed health professionals, a situation the registrar of the Allied Health Professions Council, Dr. Samuel Yao Opoku, described as worrying.
I'm so disappointed because a place like Kumasi, major primary area like Komfo-Anokye, opposite Komfo-Anokye, most all the facilities there are keeping people who are not qualified to be there. In fact, we have visited 16 facilities. I can already say that just about 3 or 4 have some of their staff, registered and licensed. The rest are keeping people whose qualification we cannot validate. They are not registered with the council. So in effect, what they are doing is illegal. And we are going to take steps to ensure that those who qualify, will be asked to go through the licensing procedure as soon as possible. Those who don't qualify will make sure that they are removed from the system. You can't render this kind of service if you are not qualified, because you are dealing with human beings. And in our practice, any mistake that is committed is going to affect the client. So we cannot continue for people's life, to be, taken over by these people who are not qualified.
At some of the facilities, the services of national service personnel were employed to cater for patients, while at other facilities, the practitioners had expired licenses. The team met management of the facilities and asked them to take steps to correct the wrongs. Dr. Yao Opoku said the council will ensure that health facilities do the right thing.
We wanted to see the certificates of the people, so we'll go back and check. If they are able to provide the certificates, that will be fine. Otherwise, we'll take the issue to the next level.
Are we going to see some arrest, maybe you embarking on this across the country?
Obviously, if when we get there and then people, who has to, face the laws, I think we'll not hesitate to do that. If you want to run a health facility, it is just important that you get people who are qualified, who are licensed, to employ. Because if today you buy a commercial vehicle and you are looking for somebody to drive, either it's a bus or a taxi, you only look for somebody who has a driver's license. So the same way, if you have a health facility and you are looking for people to work in that facility, the most logical thing is to look for people who have been certified, to work. Anything short of that, then you'll be infringing on the laws of the country. And so far as the law is there, and so far as we are dealing with human life, we should not allow that kind of system to continue to operate. So we'll apply the sanctions as the law mandates us to do.
Managers of the facilities who declined interviews assured the council that they will comply with the rules of engagement.
Officials of the council have spent time visiting these medical laboratories behind me. According to them, they will extend the monitoring to public and private health facilities across the country. They say they will not relent until they weed out medical practitioners without license. Reporting from Kumasi, I am Hafiz Tijani for Citi News.